All right, today we're going to dive into a condition that affects millions of people, but is honestly pretty misunderstood: inflammatory bowel disease. We're going to break down what it is, how it shows up, and why it's so much more than just a tummy ache. To really get a handle on IBD, you have to start with this question right here, because that's what it is for so many people: a constant, invisible battle being fought inside their own bodies. It's something that can impact every single part of your life, but it's happening in a place that nobody else can see. And that battle, it has a name: inflammatory bowel disease, or IBD for short. At its very core, what we're talking about is a chronic, long-term condition where the gastrointestinal tract is just persistently inflamed. You can almost think of it like the body's own immune system gets confused and starts attacking its own digestive tissues. This creates this vicious, ongoing cycle of inflammation, and the body trying and failing to properly heal. Now, here's the first big thing to know. IBD isn't just one single disease. It's actually an umbrella term that covers two main conditions: Crohn's disease and ulcerative colitis. And while they have a lot in common, the ways they differ are absolutely crucial for how they're diagnosed and treated. So let's start with Crohn's. And honestly, this analogy of islands in a sea, it's a perfect way to picture it. See, Crohn's can pop up anywhere in the GI tract, literally from your mouth all the way down. But it doesn't usually affect the whole thing at once. Instead, you get these patches, these little islands of deep inflammation that are separated by stretches of perfectly healthy tissue. We call those skip areas. Okay, so this is where you can really see the key differences side by side. With Crohn's, like we said, the inflammation can be anywhere, and it's in that patchy, discontinuous pattern, those skip areas. It's also often transmural, which is a fancy way of saying it can go through the full thickness of the bowel wall. Now, ulcerative colitis, on the other hand, that's usually just found in the colon. The inflammation is continuous, not patchy, and it tends to be more superficial, affecting just the inner lining. So we know what's happening on the inside, but what does this internal battle actually feel like? Well, the effects of all this inflammation aren't just stuck in the gut. They can actually ripple throughout the entire body and show up in ways you might never expect. The most common symptoms are probably what you'd guess for disease of the digestive tract. We're talking about abdominal pain, that's often kind of vague and crampy, chronic diarrhea, which can sometimes be bloody, and pretty significant unexplained weight loss. That weight loss is often tied to anorexia, not the eating disorder, but a medical term for a loss of appetite, and just this profound, deep-down fatigue that comes from your body being in a constant state of inflammation. But here's where IBD gets even more complicated, because the story doesn't just end in the GI tract, not by a long shot. So what happens when the body's inflammatory response decides to, travel and show up in other places? Well, that leads to what doctors call extraintestinal manifestations. It just means symptoms outside the gut. This can be things like painful ulcers in the mouth, specific skin lesions like these tender red bumps, a type of arthritis that can come and go, and even systemic symptoms like a fever and just that general feeling of being unwell, malaise. It really proves that IBD is a whole body condition. Now, as you can imagine, when you have that kind of inflammation going on for years and years, it can unfortunately start to cause some more serious, permanent damage. And that brings us to the potential complications of IBD. One of the most common complications, especially in Crohn's disease, is something called a stricture. It basically forms through this damaging cycle. First, the chronic inflammation just keeps going. Then, the body tries to heal itself, which creates scar tissue, a process called fibrosis. Over time, that scar tissue builds up, causing the intestinal wall to get thick and narrow, creating a bottleneck. And if it narrows enough, that can lead to a full-on bowel obstruction. Another major complication, and this one is really a classic sign of Crohn's, is a fistula. Remember how we said the inflammation in Crohn's goes through the full thickness of the wall? Well, sometimes it can actually burrow right through and create an abnormal tunnel that connects the intestine to another part of the body, like another piece of the bowel, the bladder, or even right out to the skin. And we have to mention toxic megacolon. Now look, this is rare, but it is a life-threatening emergency. It's what happens when severe inflammation causes the colon to rapidly expand or dilate. It's a really serious situation that needs immediate medical attention, for sure. So with all these different symptoms and potential complications, how in the world do doctors actually figure out what's going on? Well, diagnosing IBD isn't about a single test. It's a lot more like a detective story, where the clinical team has to gather all the clues and put the pieces of the puzzle together. So that investigation, it always starts with the patient's own story, their symptoms, their habits, their history. A physical exam can then uncover critical clues, like a tender mass in the abdomen. Then, to get a direct look inside, doctors use imaging studies like colonoscopies and CT scans to see the inflammation for themselves. And all along the way, they're playing detective, making sure to rule out other conditions that might look a lot like IBD. So when all is said and done, the diagnosis is made. And the reality is, IBD isn't a temporary bug you just get over. It's a chronic, incurable disease. For those who are diagnosed, it really becomes a lifelong journey of managing this complex condition, which is often marked by cycles of feeling good, remission, and having flare-ups. And that really brings us to our final thought. We've gone through the biology, the symptoms, the complications, all the clinical details. But maybe, beyond all of that, the most important question is the human one. How does living with a chronic, unpredictable disease truly reshape a person's life?